Good morning, everyone. Title of my paper is A Prospective Observational Study on the Effect of 0.01% atropine eye drops in the Treatment of Myopia Progression in Children. Myopia, as we know, is a significant global problem, and its annual rate of progression was found to be about 50%. High myopia is associated with many sight-threatening complications. Not only is it is a cause of ocular morbidity, but also it is a source of huge economic and social burden. Also, it causes cosmetic problems due to the need for spectacles. And high myopia could not be corrected by LASIK. So, considering the above mentioned facts, we need to find an effective solution to prevent its progression. So, is there any remedy? Here comes the role of atropine, which is a competitive reversible antagonist of muscarinic receptors. Though atropine is licensed in Singapore, it's not widely used in India because it's not FDA approved. The aim of my study was to study the effect of 0.01% atropine eye drops in the treatment of myopia progression in children and to document its side effects. The objectives were to study and compare the mean change in spherical equivalent, mean change in axial length and fundus changes between two groups, that is the group on 0.01% atropine and the group not on atropine, and also to study side effects. It was a prospective observational study conducted in the myopic children attending Little Flower Hospital OPD between November 2020 to April 2022, and the minimum total sample size was 96. Myopes above -1 diopter between 4 to 16 years were included, and myopes with other associated ocular abnormalities were excluded. After getting informed written consent and ethical clearance, the basic data of children were gathered and their parents were asked whether the child is on atropine or not. The children on atropine, irrespective of their duration of usage of atropine, were grouped into group A. They were using 1 drop of 0.01% atropine every day at night time, and also they were wearing spectacles. In group B, the children were not on atropine, only spectacles were given for them. And at initial visit and every follow-up visit, that is every 6 months for 1.5 years, following assessment was done, that is best corrected visual acuity, cycloplegic refraction, spherical equivalent, which is calculated as spherical power plus half cylindrical power, and also fundus examination was done, side effects were asked for, and axial length was also measured. And the results were 192 eyes of 96 patients were studied, that is 96 eyes of 48 patients. Both the groups were comparable in terms of gender distribution as well as age distribution. And when we come to the mean change in spherical equivalent, it was seen that it was much higher in the group not using atropine, which was statistically significant. Also, regarding the mean change in axial length increased much more in the group not on atropine, and it was also statistically significant. But when we come to fundus changes, atropine seemed to have no much effect. And regarding the side effects, only a single child reported side effect, that was blurring for near. Discussion. So according to my study, 0.01% atropine is found to be effective in retarding myopia progression compared to the group not on atropine, and it was the result found in ATOM 2 study also. But in LAM study, they found 0.05% as the best low concentration atropine. And when we come to the mean change in spherical equivalent, in my study, it was seen that 0.01% atropine is much better in controlling spherical equivalent compared to ATOM study and LAM study. Also regarding axial length, in my study, it is seen that 0.01% atropine is much better in arresting the increase in axial length compared to ATOM study and LAM study. So conclusion, 0.01% atropine is effective in retarding progression of myopia, but still it cannot arrest its progression. And 0.01% atropine has no significant side effects. 0.01% atropine usage should be made a routine clinical practice in India. Limitations, it was a short duration study with low sample size, and it was just an observational study, and the duration of atropine usage was different in group A. That's all. Thank you.
Last but one slide, when you told can arrest, you told no progression. In something you told, showed no. Last but one. This
slide, yes,
the sentence.
Yes, sir.
Is effective in retarding progression.
Retarding,
still cannot arrest its progression. What do you mean by that?
Fully cannot arrest progression of myopia. But compared to the group not on atropine, it is better in controlling the change in axial length and spherical equivalent. Still in the group on atropine, there is increase in spherical equivalent and axial length.
How that axial length is something retarded with atropine? How can it reduce the progression of myopia, retarding the progression, axial length and all? How can it happen?
Sir, 0.01% atropine is better in increasing the scleral matrix. So, and it retards choroidal thinning. So, choroidal thinning, scleral thinning, and all controlled. So, axial
You
length.
told scleral matrix is what happens?
Scleral matrix increase in extracellular matrix of
That
sclera.
means it gets thickened.
Sir, no. Thinning is prevented. So, axial
You
length.
told choroidal thinning.
Thinning will be reduced by atropine.
Reduced.
Yes, sir.
What do you mean with 0.01%? How many milligram is there per ml? So you have told now 0.01%.
Yes, sir.
I wanted to know about the milligram in per ml. How can it be? Suppose you are asked to prepare a solution of, I'm having 1% atropine is there. I want, how to prepare? You didn't know, you don't know.
No, sir.
You don't know the calculation.
No, sir. Sorry.
Simple thing is what? Just multiply by 10. 0.01 multiply by 10, how much?
0.1%.
0.01 into 10, how much?
0.1, sir.
0.1 milligram per ml, that's all. That means you must prepare solution 0.1 milligram per ml.
Okay, sir.
Understand now?
Okay.
Any question?
How long you are planning to give atropine for these children?
Ma'am, until 16 years we are giving, then we look for progression. If there is more increase in axial length and spherical equivalent, then we will have to give them again, or else we can stop. At every visit we are checking axial length and spherical equivalent.
So this was done after 1.5 years study.
Yes, ma'am. 1.5.
Okay. Do you expect any rebound effect once you stop the atropine?
Actually, in my study, I have not stopped for anyone, but in literature, they are saying there is rebound effect for 0.01% atropine. Thank you.